After age 65, posture plays a critical role in maintaining overall health. Yet, many older adults unknowingly adopt a sitting position that places excessive pressure on internal organs, especially the heart and liver. This video explains why one common sitting posture may contribute to reduced blood flow, shallow breathing, digestive discomfort, and strain on the circulatory system. You'll learn what this posture looks like, the physiological effects it has on aging bodies, and how to correct it with simple adjustments to protect vital organ function and improve long-term comfort. A common sitting posture that may be harming your body. Many older adults adopt a forward-leaning sitting position without realizing the potential consequences. This posture typically involves rounded shoulders, a curved upper back, and the torso slightly hunched forward, often seen when reading, watching television, or using a smartphone. While it may seem harmless or even comfortable in the short term, this position can gradually contribute to physical strain, especially when maintained for prolonged periods. This sitting posture compresses the abdominal region, placing subtle but continuous pressure on the organs located within the upper abdomen, including the liver, stomach, and intestines. Additionally, forward flexion of the spine can alter the shape of the thoracic cavity, decreasing lung expansion capacity and placing unnecessary stress on the heart. This issue is particularly relevant for older adults whose organs may already function less efficiently due to age-related physiological changes. A 20 study published in the Journal of Physical Therapy Science found that older adults who sat in a forward-flexed posture for more than 30 minutes at a time experienced measurable decreases in diaphragmatic movement and lung volume, which in turn reduced oxygen intake and increased cardiac workload. These findings suggest that a seemingly minor postural habit may compound over time, contributing to fatigue, shortness of breath, and reduced cardiovascular efficiency. The liver, which plays a central role in detoxification, metabolism, and nutrient storage, can also be affected by poor sitting posture. According to anatomical studies, prolonged compression of the upper abdominal cavity may impair venous return from abdominal organs, slowing hepatic circulation. While the effect may not be immediately noticeable, cumulative restriction of blood flow to the liver may contribute to subtle declines in function, especially in individuals with pre-existing liver or circulatory conditions. For example, Linda, 72, reported frequent discomfort in her upper abdomen after sitting for extended periods in her recliner. Her posture typically involved a slouched, forward-curved position with little lumbar support. After receiving guidance from a physical therapist, she adjusted her chair setup, added a small back cushion, and began sitting more upright. Within 1 week, she noticed reduced pressure in her midsection and improved breathing during rest. Additionally, a study in Clinical Interventions in Aging 2017 emphasized that prolonged sedentary behavior, especially in compromised postures, was independently associated with increased risk of metabolic syndrome in adults over 65. This highlights the importance of not only avoiding inactivity, but also ensuring correct postural alignment during seated periods. The forward hunched position can also impair diaphragmatic breathing, which is essential for older adults to maintain optimal oxygen exchange and organ perfusion. When the diaphragm is compressed, shallow chest breathing becomes dominant. This limits respiratory efficiency and can further increase the workload of the heart. To summarize, the common slouched or forward-flexed sitting posture, while easy to fall into, has significant implications for older adults. It alters breathing mechanics, increases abdominal pressure, and may negatively impact organ function over time, particularly in the heart, lungs, and liver. Awareness of these risks is the first step toward making safer and healthier posture adjustments for long-term well-being. Let's now explore the specific physiological effects of this posture in more detail. How slouched. Sitting affects the heart, liver, and circulatory system. The physiological consequences of poor sitting posture are often underestimated, particularly in older adults. A slouched or forward-flexed sitting position alters the normal alignment of the spine, diaphragm, and abdominal organs, triggering a cascade of subtle but significant changes in how the body regulates circulation and organ function. This impact becomes more pronounced with age, when cardiovascular and hepatic reserves are already reduced. From a circulatory standpoint, sitting with the upper body hunched forward narrows the thoracic cavity. This positioning can compress the heart slightly against the sternum and reduce its space for optimal expansion during diastole. According to a 2018 review in Frontiers in Physiology, thoracic restriction impairs preload the volume of blood returning to the heart, which can lower cardiac output, especially in individuals with reduced cardiovascular adaptability. For seniors with heart failure or ischemic heart disease, even minor reductions in cardiac efficiency can lead to symptoms such as fatigue or lightheadedness. Additionally, forward flexed posture increases intra-abdominal pressure, especially when maintained for more than 20-30 minutes without repositioning. This internal pressure can partially restrict venous return from the abdominal cavity, including the hepatic portal circulation. The liver depends on steady, low-resistance blood flow to perform its filtering and metabolic functions. Research from the American Journal of Gastroenterology 2019 notes that impaired portal circulation, even transiently, may reduce hepatic perfusion efficiency, potentially exacerbating conditions like fatty liver or cirrhosis in susceptible individuals. The diaphragm is another structure affected by slouched sitting. In a neutral sitting position, the diaphragm can contract downward to draw air into the lungs efficiently. However, when the torso leans forward, the diaphragm is compressed upward by abdominal organs, reducing its mobility. A 2021 study in BMC Geriatrics found that diaphragmatic motion was reduced by up to 30% in older adults who adopted kyphotic or flexed postures. This reduction leads to more shallow upper chest breathing, which is less efficient for oxygen delivery. In the long term, this change in breathing pattern may lead to mild but chronic hypoventilation, a condition where oxygen levels are lower than optimal and carbon dioxide clearance is reduced. In older adults with underlying respiratory conditions such as COPD, asthma, or interstitial lung disease, posture-related breathing limitations can further burden respiratory muscles and reduce quality of life. It's also important to consider the impact on blood pressure regulation. Sitting in a forward-leaning posture for extended periods may activate a sympathetic nervous system response due to perceived respiratory strain. This may cause transient elevations in heart rate and blood pressure. While this response is generally mild, repeated or prolonged activation over weeks or months could contribute to cardiovascular strain in older adults with hypertension. In some cases, such posture-related compression may also influence digestive function, especially in those with slowed gastrointestinal motility, a common age-related condition. Studies have shown that forward pressure on the abdomen can worsen reflux symptoms by increasing intragastric pressure and potentially displacing the stomach. In summary, the forward-hunched sitting posture common in older adults is not simply a musculoskeletal issue. It has far-reaching implications for cardiopulmonary efficiency, hepatic circulation, and overall vascular health. Scientific evidence suggests that maintaining a neutral, upright sitting position can support organ function and reduce strain on aging systems. The next section will explore how to identify signs of posture-related strain and what symptoms to look out for. Recognizing the warning signs of harmful sitting posture. Identifying the signs of poor sitting posture is an essential step in preventing its long-term health effects, especially for adults over 65. Because postural habits often develop gradually and without pain in the early stages. Many individuals are unaware that their daily sitting position may be contributing to fatigue, discomfort, or even more serious organ-related symptoms. One of the most common early indicators is shortness of breath or shallow breathing during rest, particularly while sitting for extended periods. This can be subtle, such as the need to sigh more frequently or feeling mildly winded when standing up. As discussed in a 2021 publication from Respiratory Medicine, older adults with postural thoracic compression exhibit a significant reduction in oxygen intake, often without realizing it. Over time, this can lead to a sensation of fatigue that is mistakenly attributed to aging rather than reduced pulmonary efficiency caused by posture. Another important sign is upper abdominal pressure or discomfort, often misinterpreted as indigestion or bloating. This pressure results from prolonged compression of the abdominal organs when the upper body is tilted forward. A study published in Gastroenterology Research and Practice 2018 confirmed that forward-leaning posture is associated with higher intra-abdominal pressure, which can exacerbate symptoms in individuals with gastroesophageal reflux or slowed digestion. Circulatory symptoms can also appear. These may include cold feet, slight ankle swelling, or a tingling sensation in the lower extremities after sitting. These signs are indicative of impaired venous return, particularly when blood flow from the legs and abdominal organs is partially restricted due to prolonged flexed sitting posture. In aging adults with reduced vascular elasticity, these effects become more pronounced. A 2019 article in the Journal of Geriatric Cardiology noted that lower extremity circulation declines faster in individuals who remain seated in a slouched position for more than 45 minutes at a time without repositioning. For example, Linda, 72, began experiencing tingling and numbness in her toes after watching television each evening. She attributed it to poor circulation due to age. However, her physical therapist observed that Linda consistently sat with her torso curved forward, compressing her lower abdomen and hips. After switching to a more upright chair with lumbar support and standing every 30 minutes, her symptoms significantly improved within 2 weeks. Another frequently overlooked sign is back discomfort, particularly in the lower thoracic and lumbar regions. While many assume this pain comes from general spine aging, it often reflects mechanical stress caused by poor sitting ergonomics. Over time, weakened postural muscles can no longer support the spine in neutral alignment, leading to compensatory curvature and muscular strain. This muscular fatigue further reinforces poor posture, creating a negative feedback loop. In more advanced cases, posture-related strain may affect blood pressure and heart rate variability. Some individuals report feeling dizzy or lightheaded after standing from a seated, slouched position. A contributing factor is reduced venous return while seated, followed by a sudden demand on the cardiovascular system upon standing, a form of orthostatic intolerance, which has been linked in part to prolonged improper posture in older adults, aging, and disease. 2020. Recognizing these warning signs early allows for simple but effective interventions, such as posture correction, seated movement breaks, and supportive seating adjustments. By paying attention to subtle changes in breathing, abdominal pressure, circulation, and muscle fatigue, older adults can prevent complications that arise not from disease, but from habitual positioning of the body. The next section will cover how to correct these posture-related problems using clear, evidence-based adjustments that promote better circulation, organ support, and overall comfort. Correct sitting posture. After 65 practical adjustments to reduce organ strain, improving sitting posture in older adults is both achievable and impactful. Small, Intentional adjustments can significantly reduce pressure on the heart, liver, and digestive organs, while also supporting better respiratory and circulatory function. The key is to maintain a neutral spinal alignment, which keeps the body upright without straining any one area for too long. The ideal sitting position begins with the pelvis. It should be positioned slightly forward, allowing the spine to maintain its natural curve. The back should remain straight, with the shoulders relaxed and gently pulled back, not rounded. Feet should be flat on the floor, with knees at roughly a 90-degree angle and thighs parallel to the ground. The head should align with the spine, avoiding the common habit of leaning forward or downward to look at a screen or book. To support this position, lumbar support is often necessary. A small cushion or rolled towel placed at the lower back helps prevent slouching and maintains spinal alignment. According to a 2017 study published in Ergonomics in Aging, lumbar support significantly reduced the tendency to fall into kyphotic hunched posture in participants over 65. The same study also noted a 12% improvement in breathing efficiency when lumbar support was used consistently over a 4-week period. Adjusting seating height is also important. Chairs that are too low force the knees above the hips, encouraging forward pelvic tilt and abdominal compression. On the other hand, overly high chairs may reduce foot contact with the floor, limiting stability and circulation. The optimal chair allows both feet to rest flat and keeps the pelvis level. If needed, a small footrest can help achieve this balance. Armrests, when available, should support the forearms without elevating the shoulders. This minimizes upper body tension and encourages a more upright posture. Screens or reading materials should be at eye level, especially for prolonged activities like watching television or using a computer. Constantly looking down contributes to forward head posture and thoracic compression. Movement breaks are essential, even with perfect posture. Sitting still for more than 30-45 minutes can impair circulation and organ perfusion, regardless of position. A 2020 meta-analysis in the Journal of Aging and Physical Activity found that breaking up seated time with light movement, such as standing, walking in place, or shoulder rolls, reduced markers of systemic inflammation and improved lower limb blood flow in participants aged 60 and above. For Linda, 72, implementing these changes had noticeable effects. She had been experiencing mild shortness of breath and bloating while sitting for long periods. After adjusting her seating posture, raising her chair slightly, using a small lumbar pillow, and standing every 30 minutes, she reported greater ease of breathing and reduced abdominal tension within 10 days. Her case reflects how posture, often overlooked, can directly influence how older adults feel day to day. For individuals with limited mobility or those who must sit for extended periods, tilt-in space or ergonomic chairs may be beneficial. These chairs allow the user to recline slightly while maintaining spinal alignment, reducing gravitational compression on the abdomen and thorax. According to a 2019 report in Clinical Rehabilitation, such supportive seating improved comfort levels and oxygen saturation in older adults with mobility impairments during extended sitting sessions. Incorporating simple physical reminders such as posture cues placed on the wall or using seated posture-correcting devices can also reinforce healthy habits. While technology is no substitute for consistent awareness, it can help older adults gradually retrain their posture without discomfort or effort. In conclusion, postural correction does not require complex interventions. Through basic but consistent changes in sitting habits, chair ergonomics, and movement frequency, older adults can actively reduce strain on their cardiovascular and digestive systems. These adjustments support long-term well-being, especially for those managing age-related conditions. In the final section, We'll highlight key takeaways and offer a practical summary to implement these strategies effectively. Long-term benefits of improved sitting posture in older adults. Sustaining a correct sitting posture after the age of 65 offers wide-ranging benefits that go beyond musculoskeletal alignment. It plays a critical role in protecting internal organ function, preserving respiratory and circulatory efficiency, and maintaining overall quality of life. When applied consistently, proper sitting habits can contribute meaningfully to long-term health outcomes in older populations. One of the most significant benefits is the improvement in cardiovascular performance. Maintaining an upright seated position reduces thoracic compression, allowing the heart to function with less resistance. This optimizes venous return and cardiac output. A 2021 clinical review in the Journal of Geriatric Cardiology noted that upright posture in seated individuals over 65 was associated with better heart rate variability and improved oxygen uptake, particularly during daily activities such as reading or eating. Over time, this may contribute to reduced fatigue and better endurance in routine tasks. In terms of hepatic health, reducing abdominal pressure supports healthier blood flow through the portal venous system. When the liver receives adequate circulation, it can more effectively filter blood, regulate glucose, and store essential nutrients. For older adults with early-stage non-alcoholic fatty liver disease, NAFLD, or metabolic syndrome, postural improvement can complement medical and dietary interventions. A 2018 study published in Hepatology Research found that lifestyle factors, including sedentary posture, independently influenced hepatic enzyme levels and liver stiffness in older adults even after adjusting for body mass index and physical activity. Respiratory function also benefits from a postural correction. By promoting full diaphragmatic movement, upright sitting enables deeper, more efficient breaths, which are essential for maintaining oxygenation and carbon dioxide clearance. In older adults, this is especially important due to age-related reductions in lung elasticity and chest wall mobility. A 2019 study in Age and Aging observed that participants aged 70 and above who practice postural breathing exercises experienced a 15% increase in vital capacity and a marked reduction in self-reported breathlessness. Proper posture can also reduce digestive discomfort, which is frequently reported in older adults. Sitting in a forward-hunched position compresses the gastrointestinal tract, slowing gastric emptying and increasing the likelihood of reflux. By adjusting the angle of the spine and relieving abdominal pressure, digestion improves. Linda, 72, who had been struggling with mild reflux symptoms, noted significant relief after modifying her posture and using an upright chair during and after meals. She was later advised by her physician to maintain this routine as a supportive measure alongside dietary adjustments. Additionally, upright sitting helps maintain neuromuscular integrity. Poor posture often leads to imbalances in muscle tone, particularly in the postural stabilizers, such as the lumbar extensors, abdominal muscles, and neck flexors. These imbalances can increase fall risk by impairing balance and proprioception. A randomized controlled trial, published in Physiotherapy Research International 2020, demonstrated that posture-focused training reduced forward trunk inclination and improved gait stability in participants aged 65 to 80, with noticeable effects after just 6 weeks of implementation. Even cognitive performance may be modestly influenced by posture. Emerging research suggests that better oxygenation and circulatory flow resulting from upright sitting may support brain perfusion. While more studies are needed, initial findings from Neuroscience Letters 2022 indicate that posture-induced improvements in oxygen saturation were associated with enhanced attention and short-term memory recall in older adults. From a practical perspective, The cumulative effects of improved posture translate into greater daily comfort, reduced dependence on assistive devices, and better tolerance for activities of daily living. Many seniors report feeling more alert, breathing more easily, and experiencing less physical strain during prolonged seated periods. Overall, maintaining a healthy seated posture is a low-effort, high-reward strategy for aging well. It supports the function of vital organs, contributes to mobility, and reduces the likelihood of developing posture-related complications. In the final segment, we will summarize the key actions you can take to protect your posture and health for the years ahead. The way we sit may seem like a small detail in daily life, but for adults over 65, posture plays a central role in protecting the health of vital organs. As we've seen, sitting in a slouched or forward-leaning position can gradually place pressure on the heart, reduce liver circulation, limit lung expansion, and contribute to symptoms that are often misunderstood as inevitable parts of aging. Fortunately, these effects are not permanent, and they are preventable. By adopting a more upright, supported sitting posture, allowing for proper spinal alignment and organ space, older adults can significantly reduce internal strain and improve overall comfort. Whether you are reading, eating, or watching television, maintaining neutral posture, taking regular movement breaks, and using ergonomic support can make a real difference. Simple changes like using lumbar cushions, adjusting chair height, and keeping your screen at eye level can go a long way in preventing issues before they start. These practices support not just musculoskeletal health, but also better breathing, digestion, and circulation factors essential to aging well. If you found this information helpful, please consider giving this video a like and sharing it with someone who may benefit. Don't forget to subscribe to Radiant Health 60 for more science-based guidance on healthy aging. Your health is shaped by daily choices, and it's never too late to sit smarter.